What if I told you that the same chemical that kills rats is right now saving millions of human lives around the world? It sounds impossible, but it's absolutely true. Today, we're going to uncover one of medicine's most shocking stories. We'll journey back to a mysterious epidemic that was killing healthy cattle across North America. We'll follow the brilliant scientists who solved this deadly puzzle. And by the end of this video, you'll understand how a substance designed to poison rodents became one of the most important medicines ever created. This is the incredible transformation of Warfarin, from deadly rat poison to life-saving blood thinner. Trust me, this story will blow your mind. Complete Warfarin script. All sections. Picture this. It's the 1920s in rural Canada and across North America. Farmers are waking up to their worst nightmare. Healthy, strong cattle that were perfectly fine yesterday are now lying dead in their fields. But here's the terrifying part: these animals are bleeding to death from the inside. There are no visible wounds, no signs of injury, nothing that makes sense. One day the cattle are grazing peacefully, the next day they're gone. Farmers are losing their livelihoods and they have absolutely no idea why. The bleeding is so severe that even small cuts become fatal. Veterinarians are completely baffled. They've never seen anything like this before. The only clue? All these dying cattle have been eating the same thing: sweet clover hay. But sweet clover was supposed to be good for cattle. It was nutritious and widely used. So why was it suddenly turning deadly? This mystery was about to change medical history forever, but nobody knew it yet. Enter the brilliant minds at the University of Wisconsin. These scientists weren't going to let this mystery go unsolved. They rolled up their sleeves and got to work. The year was 1939, and they had a hunch. If sweet clover hay was the common factor, then something in that hay had to be causing the bleeding. But what exactly? Led by a determined researcher named Carl Paul Link, the team focused their investigation on spoiled sweet clover hay. Not fresh hay, but the moldy, damaged hay that had been sitting around. They spent countless hours in their laboratory, testing sample after sample. Then came the breakthrough moment. They discovered that when sweet clover spoils, it produces a powerful compound that completely disrupts the blood's ability to clot. This chemical was preventing the cattle's blood from forming the clots needed to stop bleeding. They had found their killer. Little did they know, they had also found something that would revolutionize medicine. The compound they isolated would soon become one of the most important drugs in human history. Now here's where the story takes a fascinating turn. The Wisconsin scientists realized they had discovered something incredibly powerful. This compound could stop blood from clotting completely. But instead of immediately thinking about medicine, they had a different idea. What if they could use this against pests? By 1948, they had developed the world's first anticoagulant rodenticide. The logic was brilliant and deadly simple. Rats would eat bait containing this compound, and just like the cattle, they would start bleeding internally. Unlike cattle though, rats couldn't be monitored or treated. They would simply bleed to death from tiny internal injuries that their bodies couldn't heal. The product became an instant success worldwide. Farmers and pest controllers finally had a weapon against rat infestations that actually worked. The compound was incredibly effective because rats had no idea they were being poisoned. They would eat the bait, feel fine for days, then quietly die from internal bleeding. It was the perfect silent killer for unwanted rodents. But some forward-thinking researchers started asking a crucial question: could this rat poison actually help humans? It sounds crazy, but hear me out. While rats were dying from uncontrolled bleeding, humans were dying from the exact opposite problem: blood clots. Every day, thousands of people suffer heart attacks and strokes caused by blood clots blocking vital arteries. Their blood was clotting too much, not too little. What if this compound could be used in smaller, controlled doses to prevent these deadly clots? The idea was revolutionary but risky. In 1954, after years of careful testing, the compound was finally approved for human use under the brand name Coumadin. The same chemical that killed rats by preventing blood clotting would now save human lives by doing exactly the same thing. The difference wasn't in the mechanism, it was all about the dose and monitoring. This marked the birth of modern anticoagulant therapy, and millions of people around the world would benefit from this incredible discovery. Let me explain how this works in simple terms. Your blood has an amazing ability to form clots when you get injured. This prevents you from bleeding to death from cuts and wounds. The clotting process relies heavily on vitamin K, which helps your body produce the proteins needed to form these life-saving clots. Now, warfarin works by blocking vitamin K from doing its job. Think of vitamin K as the key, and warfarin as something that changes the lock. When warfarin is in your system, vitamin K can't activate the clotting proteins properly. This means your blood becomes much less likely to form clots. For someone at risk of heart attack or stroke, this is incredibly beneficial. The dangerous clots that could block arteries and cause life-threatening events simply can't form as easily. Your blood flows smoothly through your vessels, reducing the risk of blockages. But here's the critical part: the dose has to be just right. Too little warfarin, and dangerous clots can still form. Too much, and you risk bleeding like those cattle from the 1920s. Here's the mind-blowing irony of this whole story. The exact same mechanism that kills rats is what saves human lives. In both cases, warfarin blocks vitamin K and prevents blood clotting. The difference is entirely in how it's used. Rats get a massive, uncontrolled dose hidden in bait. They have no medical supervision, no monitoring, and no way to reverse the effects. They simply bleed to death from internal injuries that can't heal. Humans, on the other hand, receive carefully calculated doses based on their body weight, medical condition, and response to the drug. Doctors monitor patients with regular blood tests to ensure the clotting time is in the therapeutic range, not too much, not too little. If bleeding becomes a problem, there are antidotes available. Vitamin K can be given to reverse warfarin's effects in emergency situations. The same substance that's a death sentence for rats becomes a life-saving treatment for humans, all because of careful dosing and medical supervision. It's a perfect example of how the difference between medicine and poison often comes down to the dose. Today, warfarin is one of the most prescribed medications in the world. Millions of patients rely on it every single day to stay alive. People with atrial fibrillation, a heart rhythm disorder, use warfarin to prevent strokes. Patients who've had blood clots in their legs or lungs depend on it to prevent new clots from forming. Those with mechanical heart valves need warfarin to prevent clots from forming on the artificial valve surfaces. The impact has been absolutely staggering. Before warfarin, many of these conditions were essentially death sentences. Now, patients can live normal, healthy lives with proper treatment. Studies show that warfarin prevents thousands of strokes and heart attacks every year. Even though newer blood thinners have been developed, warfarin remains widely used because it's effective, well understood, and affordable. For many patients, especially those in developing countries, warfarin is still the best option available. The compound that started as a solution to mysterious cattle deaths has become one of modern medicine's greatest success stories. But warfarin isn't without its problems. Managing this drug is like walking a tightrope. Patients need regular blood tests to check their clotting time, sometimes as often as once a week. The drug interacts with many foods, especially those high in vitamin K like spinach, kale, and broccoli. Even something as simple as eating more salad than usual can affect how the drug works. Alcohol, antibiotics, and many other medications can also change warfarin's effectiveness unpredictably. The dosing has to be precise. Too little and you're not protected from clots, too much and you risk dangerous bleeding. Some patients find these restrictions frustrating and difficult to manage. This is why newer blood thinners have been developed that don't require as much monitoring or have as many food interactions. However, these newer drugs are often much more expensive and don't have antidotes readily available if bleeding occurs. For many patients and doctors, warfarin remains the gold standard despite its challenges. What an incredible journey we've taken together today. We started with mysterious cattle deaths in 1920s farmlands and ended up with one of medicine's most important discoveries. Think about it, the same compound that was killing livestock became a life-saving medication for millions of people worldwide. This story perfectly shows how scientific curiosity and determination can turn disaster into triumph. Those University of Wisconsin researchers didn't just solve a farming problem, they revolutionized cardiovascular medicine. The substance that kills rats by preventing blood clotting saves human lives by doing exactly the same thing. It's the ultimate example of how context, dosing, and medical supervision can transform poison into medicine. From cattle mystery to rat poison to life-saving drug, warfarin's story proves that sometimes the most important discoveries come from the most unexpected places. Science has an amazing ability to take something deadly and turn it into something that heals. I'd love to hear from you in the comments. What other accidental medical discoveries do you know about? Medical history is full of these amazing stories where scientists stumbled upon life-changing treatments while looking for something completely different. If this story amazed you as much as it amazed me, please give this video a thumbs up and subscribe for more incredible medical mysteries and scientific breakthroughs. And don't forget to share this video with anyone who loves surprising science stories. Trust me, they'll be just as shocked as you were to learn that rat poison and blood thinner are basically the same thing. Thanks for watching, and I'll see you in the next video where we'll uncover another mind-blowing medical mystery.